Let me tell you about my ergonomics journey. So I started dental school at age 23. I finished at age 27. I didn't get my first pair of loupes until age 30. Okay, so I have 7 years under my belt at this time. And here's the cool thing. When you're that young, you're bulletproof. You can be a contortionist looking at number 15 like this. It doesn't matter. You can put your leg over your head. You're gonna be fine. You're bulletproof. Then I got my first set of loupes because your vision starts to change. I'm like, oh, wow, I can see things better. But here's the thing is they put you with a low magnification and a really flat angle on it. So then what happens is that was the beginning of the end. My first set of loupes is what fucked everything up. Low magnification, a really flat down angle like this, and it forced me to start doing dentistry like this. This was actually worse than what my original angle was because I could kind of cheat it and sort of look and tilt my eyes down, but with the flat angle, you can't tilt your eyes down. So for the next 10 years after that, I had to tilt my head down like this. Well, think about this from an ergonomic perspective. The second you drop your chin towards your chest, you're putting massive compression on C5 and C6. Trust me, when you're in your second decade of dentistry, you're not bulletproof anymore. That's where the aches and pains come. And it all started with getting sore neck muscles, and you go at the end of the day, kind of like this, you're good. But now all of a sudden the soreness starts turning into pain. And you start getting pain in your neck, pain throughout the neck muscles, and then pretty soon you have arm pain, shoulder pain. Once you enter your second decade, you can't get away with it anymore. And the compression and from your head tilting down in bad posture, the pain becomes more consistent and more constant. So then what did I do is I switched to microscopes. And I was like, hey, this will be fantastic because I'm gonna have to be like a submarine captain doing dentistry now, looking like this. And what I would say is that if you're an endodontist or you're just doing single tooth dentistry, it is a really good solution because it forces you to be upright. But the kind of dentistry that I'm doing, which is multi-unit dentistry, I'm doing a lot of restorative and aesthetic dentistry, you gotta see an entire arch in order for the case to make sense. And the amount of time I was spending moving the scope and trying to move the patient's head and then get the thing back in focus, it was slowing me down big time. So then I went back to my loupes. And guess what happened with that? Then I had more pain coming back again. Until the best day of my ergonomic life happened. I learned about refractive loupes from Bryant Dental, and it changed my life. Now there's a story behind this. Because as soon as I saw about these loupes, I'm like, I gotta get a pair. And I reached out to you guys, and you're only in London. And I was like, are you kidding me? Like there's no way to get a pair? So what did I do? I hopped a plane and went to London. And to me, it was a no-brainer. My health is on the line. This is a one-way street. If you practice dentistry long enough, you saw what your dental instructors looked like. They all looked like Quasimodo the Hunchback. Every last one of them, hunched over like this, complaining about their back and neck. And to me, that's a cautionary tale. And if there's something out there that can help fix this problem, well, if the solution's there, who's the dummy for not taking advantage of the solution? So I hopped a plane, I went to London, and Bryant Dental could not have been more fantastic. They came and met me, I got measured, and a short few weeks later, I got my first set of loupes. Now this is a funny story. I got my loupes and I put them on for the first time and I reached for my instrument and I was reaching in the wrong direction, and it took me about a day to get used to the hand-eye coordination. And that's actually a common question that people will ask. They'll say, well, how do you relearn because your eyes are looking this way and your hand's going that way? It happens so fast. You retrain very quickly. Funny thing is, till this day, patients still ask me where I'm looking. They feel like I'm looking out the window and then I'm working down like this. Within a matter of weeks, and I say this with like a sense of relief and exhaustion to say, the pain started going away. And now I work every day with my chin up and I don't have that neck pain. The profession of dentistry has miserably failed us as clinicians, okay, for two reasons. Because number one, ergonomically, we haven't been better trained with what was available. And what I mean by that is calendar year 2025, we have solutions to the most common problem, which is the cause of injury, pain, early retirement, and disability in clinical dentistry, which is this problem right here. It should be standard operating procedure for every dental school to make sure that dental students learn how to have good posture right out of the gate. And that comes from starting with a pair of these and the very chair that I'm sitting on, having a proper ergonomic stool to get the hips and the pelvis right so the whole body can be in alignment. That's the only chance that we have as clinicians to not be debilitated. So every dental clinician at every level, whether you're a dental student, a young dentist, or even senior in your career, it doesn't matter. You owe it to yourself to give yourself the gift of posture and ergonomics and pain-free dentistry. Dentistry is the most ergonomically unfriendly profession that there is. We all know it. Bryant Dental has solved it.